Morning. I'm Captain Corinne Stanish. I'm with the Sarasota Police Department in Florida. Also speaking with me today is going to be Investigator Mike Harrell. He's with the Criminal Investigation Division. He is one of the assistant lead investigators in this case, and he's going to be here to answer any specific questions that you may have. I would like to take this time to also thank Rob Simmons. He is the investigator supervisor with the Florida Department of Health, and also with him is Eliana Swanson with the Department of Health. She is the investigation manager. On July 19th, 2017, the Sarasota Police Department Narcotics Unit and our Street Crimes Unit executed a search warrant at 1819 Main Street, Suites 401 and 402. Suite 401 is the Diagnostic Center for Disease, and Suite 402 is the High-Intensity Focused Ultrasound Centers of America. Both of those offices belong to Dr. Ronald E. Wheeler, and here is a picture. This investigation began into Wheeler's practice after the Department of Health received an anonymous complaint that he was practicing medicine and seeing patients after his medical license was revoked by the state of Florida on April 20th of 2017. An undercover operation was conducted by the Sarasota Police Department, and we developed probable cause to get a search warrant for the offices and an arrest for Dr. Wheeler. He was arrested at his office on July 20th, 2017, and charged with unlicensed practice of a healthcare profession. As a result of the search warrant, detectives seized a substantial amount of patient records. They are now being kept in a secure location. This investigation is going to be ongoing, and additional charges are expected. If you are a patient of Dr. Wheeler's and you need copies of your medical records, please contact Detective Doug Vollmer at 941-954-7080. Also, if you believe you are a patient of Dr. Wheeler and you had seen him after April 20th, 2017, please also call Detective Vollmer at that number I provided. I'm very proud of all the hard work that these investigators put into this case and our partnership with the Department of Health. It has been our utmost importance for patient safety. I'm now going to turn this over to Investigator Harrell for any specific questions that you may have. Thank you.
Thank you, Captain.
You're welcome.
Good morning. Do we have any questions specific to the investigation that you might have?
Can you talk about why his license was revoked in the first place?
Just to be clear, and I will touch on that, but to be clear on that, the Sarasota Police Department had no involvement in the actual revocation of his license. You're going to be provided a link to the Department of Health website that will give you all of the complaints against him in detail. I guess I could tell you that basically he was considered to be below the standard of medical practice in the state of Florida by the Board of Medicine, and they chose to revoke his license based on those complaints April 20th of this year.
When you say below, can you give us any example of what led to the arrest as well?
Well, again, that's going to be detailed in the complaints, and they are available to the public at this point, and you can read them in detail, everything he did to each of the 4 complainants that brought this action. But a quick, I guess, thing I can tell you is that he was specifying prostate cancer treatments. The standard of practice in the state of Florida is that cannot be diagnosed without a tissue biopsy. He was diagnosing patients as having prostate cancer without any type of biopsy being done. He was going strictly off of MRI films.
And how was he treating them, and what was he charging?
We don't know the specifics of all of that, but we do know that one of the procedures he was offering was what the captain alluded to, the HIFU treatment, which is high-intensity focused ultrasound waves, and he was charging around $45,600 per treatment for that.
How was he able to get away with this license being revoked in April? That's 3 months before this whole operation happened.
Well, we were not aware that his license were revoked until the Department of Health came to us with their complaint. they knew that he was revoked, and they knew that he was served with the actual revocation paper. So there was no question that he knew he was revoked. What happened was they received an anonymous complaint that he was still seeing some of his patients post-revocation. So that prompted their investigation, which prompted them to contact us for assistance.
And at what risk does he put patients when he's operating without a license?
Well, that could vary. I mean, this procedure that he offered, the HIFU procedure, was done as an office-based surgical procedure, and it required anesthesia. So, you know, we can't really comment on what type of injuries could have happened, but obviously, as with any procedure, there were possibilities for injury.
Did any patients suffer any serious injury or die because of this procedure?
Not that we're aware of, and I mean, certainly not since the revocation when we became involved, but we are actually reaching out to patients now who may have seen him after the 4/20/17 revocation date so that we can continue. At this point, the arrest of Dr. Wheeler is just the beginning. We have a lot of research to do, a lot of records to go through, a lot of phone calls to field and determine if he did see other patients.
Any idea how many patients he's treated since his license was revoked?
That could be anywhere at this point from what we've determined from 4 to maybe 12.
Has he been cooperative with your investigators after the arrest?
No, he has not.
Is it possible that he diagnosed somebody with cancer who maybe were healthy?
Well, I believe when you'll find in the documentation that that was the cause for the complaints.
How important is it that you hear from his past patients, that they reach out to you, if you don't, just to talk to them?
Well, it's very important because, as I said, we made the arrest and the search warrant based on the other undercover operation that we put together, but that was us. We want the patients that he may have wronged to come forward. They're the focus of our investigation from this point forward. So anybody who knows of Dr. Wheeler and saw him on or about April of 2017, it's very important that they contact us.
These were expensive treatments he was doing.
Yes, I've already fielded several phone calls from people who, at this point, paid the $46,500 and have yet to receive treatment.
Did it work at all?
I'm sorry?
Is it a common way of treating this?
It was not even legal in the United States until the end of 2015. About November of 2015, it became legal in the United States. So it's still not a mainstream treatment. It's not recognized by a lot of people, but it is something that is being done by other physicians in the state of Florida.
Can we say that he was selling his services to give people false hope of maybe prolonging their lives?
Well, you can look at the complaints, and I think you'll find that detailed right in the complaints with the Department of Health.
How common do you think these sorts of situations are? We heard about one a few months ago of a dentist practicing like this. Is this a common thing?
Well, the Florida Department of Health probably knows more about how common something like that is. I mean, we only know when it comes to our attention and we actually verify, and that's what we did. When it came to our attention, we verified who Dr. Wheeler was, verified that he did have a practice here in the city of Sarasota, and then we basically began our research to find out who he was and what he was doing. And we read the online public complaints to see what the focus of the problem was, and that's how we established our undercover operation to go in and see if we could in fact verify this.
How much does the onus fall on the patient to make sure that the doctor is licensed? Is there a precaution that they should be taking before they go see someone?
Well, I mean, that obviously is an individual right and concern. I mean, I think if you polled anybody in your viewership, you'd find out that probably the majority of people don't do that. But I think in law enforcement, we should stress that that's available online and to the public. You can check your physician or a nurse or any licensed professional in the state of Florida. You can check within 5 minutes on the internet to find out if in fact they are licensed and if they have any discipline history.
Can you talk about the video of the search warrant and what it uncovered?
Well, what we were looking for in the search warrant was patient records, basically. We knew that we needed to focus on the revocation date forward. That is what our concern was, because his license were not suspended. They were not encumbered in any way prior to April 17th. So had you looked online, you would have found that they were free and clear, and he was able to practice. And in fact, he was. So we wanted to make sure if there were records in there indicating somebody had been treated by him in any way after the April 17th date, that we could recover those records.
Any other questions?
How much money do you think he made during this period of time?
Of the revocation? Well, that's hard to say because there were some other issues. The machine he was using in his practice was taken away by the supplier of the machine, so then he had to start looking for alternative places such as Mexico to have the treatments done. So we know that he was charging $46,500 per patient, and that's what we're going to determine at this point, how many patients he saw after that time.
I'm sorry, he was trying to get procedures done in a different country. Does that cross some sort of other law enforcement line potentially for you guys? Does that involve federal authorities or?
Well, we have no jurisdiction, obviously, in Mexico, and that would fall to the Mexican authorities. I mean, he's not doing anything here in America for American law enforcement to act on unless he set that up with a pre-op appointment or post-op visit here in America and certainly in our jurisdiction.
If the high view had become legal in the United States, why would he need to go outside?
Well, he didn't need to any longer. He actually obtained a machine for his practice, but at one point, for whatever reason, the machine was taken away by the manufacturer. So, and we're still trying to determine if that was unable to make payments or exactly why. But other physicians began to learn of his issues with his license, even though they were still clear, and they were refusing him access. So he then had to try to redirect his patients back to Mexico, where he began this treatment back as early as 2006.
The patients who have been calling you, can you give us an idea of just kind of their demeanor? Have they been panicked? Have they been stressed out now kind of with these new revelations? What have they been telling you?
Well,
maybe you can tell us.
I mean, certainly some of them are out of pocket $46,500, and they're quite upset about that. So they're more upset about the fact that they did not go the extra mile to verify that this was the right thing to do, and that's understandable. But so far they've been disappointed, but the ones that we've talked to as of this morning have been cooperative.
Any chance of them getting any money back?
Well, that's yet to be seen. I mean, obviously, if they gave him the money prior to the revocation and there was, you know, a financial contract, they may have some civil litigation ahead of them. If we determine that he fraudulently obtained the money, knowing that he was not going to be able to pursue the treatments, then that may be an avenue we look at as well.
So the patients he's treated since April, did he actually do the treatments, just take the money? Or did he ever actually do the treatments?
That's what we're trying to determine at this point. That's the people we're waiting to contact. We have medical files that indicate he saw these patients after April 17th, but we're waiting for the patients to contact us so that we can go into those files in depth and find out if he treated them and what the extent of the treatment was.
I'm curious, what has he said to investigators?
Nothing at all. He invoked his privileges to an attorney on the moment he was arrested, and we have not spoken to him anymore.
What kind of staff did he have?
He had a staff at one point, but he slowly began to let them go, and I can only surmise that was because his business started to decline once physicians and surgical centers in the area knew what kind of trouble he was facing. So he began to let his staff go, and probably May of this year was the last staff member to go.
How many of these patients were from out of our area?
The majority of them were. He got most of his patients from the internet. He claimed that he was the world-renowned prostate cancer specialist, and I've talked to people this morning as far away as Colorado and Kansas. So they came here not knowing him, not knowing Sarasota, did everything he asked them to do, get a room here, wait for the treatment, a room to stay until after the treatment, and then they went home. They were not aware of this until they started getting word-of-mouth phone calls.
So he really played on people's fears?
That would be an opinion that I think most people would share. If you read the complaints that the Department of Health has, I think that's exactly what prompted those complaints.
And you said it's confirmed that at least one of the patients did not have prostate cancer and was treated for it?
According to the complaints, again, and you can read those yourself, but that's what is indicated in the complaints, that upon obtaining second opinions and a tissue biopsy, they had no cancer.
So in looking at the patients that he was treating and the type of disease that they thought they had, What did he do? I mean, in a way, how did he lure these people in? What did he play off of to be able to get them to turn over so much money?
Well, I think, again, reading the complaints, you will see that he told these people that he diagnosed them with a very aggressive form of prostate cancer, and that the most successful, possibly the only successful way was this HIFU treatment. And he continued to bring them into his office for follow-up appointments, where he continued to tell them this was probably their only option. So we know of the 4 complaints that were made to the Department of Health. They went out and got second opinions. We don't know how many people at this point did not go for second opinions, but we will learn that soon.
Was he the only person in the office at the time of the arrest?
Yes, he was.
And was that relatively smooth? I guess he didn't say anything, but they were able to obtain it pretty without any.
We became aware that he entered his building and was going up to his office, and we responded within a minute and a half. So basically, the officers caught him just inside the door, actually picking up a copy of the search warrant that was left behind, trying to find out what had happened while he was gone, and that's when they walked in and took him into custody.
When was SPD first contacted by DOH?
I believe the date was June 23rd, give or take a couple of days.
So a few weeks to collaborate a plan and a strategy on undercover approach.
That's correct. We had to do some research to find out if in fact he was here, make sure he was in fact revoked, that he was still around, and that this was possibly going on here in the city.
He was selling these pills, the peanuts.
Yes, that was something that he developed. It was basically an herbal type supplement, and they're probably available at GNC or anywhere else, but that was his patent that he obtained, and he wanted all of his patients to take those supplements, and he prescribed exactly the doses and the amounts that they should take, when they should change, and so forth.
Was there any danger to the people that have taken them? Should they stop taking them? I mean,
well, we don't know. I mean, from what we read online, it's an herbal supplement that was approved. And they were not a prescription device. They were just something that he recommended strongly to his patients that they obtain those and take them.
Do you know the cost of those pills?
No, we don't.
Any idea how much money he brought in using his methods over the years?
No, I couldn't tell you that at this point. Again, we've only been working on this for a few short weeks, and really, when I say this, the investigation is just now going to begin, and we hope to find out a lot more.
What are you expecting to find, knowing what you know?
Well, I'm expecting that these patients that we believe were seen after the revocation date will come forward. And I hope they will, and they will cooperate with us, which means if that's the case and we verify this, then we'll have additional charges on him.
But how large do you think? I mean, do you think this is going to blow up with dozens of patients and hundreds of thousands of dollars?
I don't think so, based on our preliminary information. I mean, we think it could be between maybe 4 to 12 at this point. Obviously, we're basing that on what we saw in the office. Now, if records had been removed from the office, that's going to take some time for us to get to the bottom of it and interview witnesses, interview former employees, and that may help us in that direction.
You said they found him online. Was he advertising, or was there a way he was, reaching people?
Well, he has 2 websites online. One of them is his practice website, and the other one is the HIFU website, which were both in the same building. And people research, as you can imagine, when they're told that they're having an elevated prostate level or something to that effect, they begin to research. And of course, if you read his websites, which you can do, they're still up, and there's no indication on the websites that he cannot practice any longer or that he will not practice any longer. You can see how he is trying to entice patients to come to him, making them think that he is the world-renowned expert in this illness.
What's the message? What's the word of warning to anyone out there when they're looking for medical treatment?
Well, I think it's simple. I mean, we always get references when we look for a contractor to redo our kitchens, and we look for references when we buy automobiles. I think it is certainly important that if you're going to see a physician, that you constantly check the state of Florida's Department of Health website and make sure they're still a licensed physician. And if they have disciplinary action on them, it will tell you that as well. It will be on that website.
This might be sort of an obvious question, but what measures does law enforcement have to ensure that he doesn't start practicing again, either here or elsewhere?
Well, obviously, things like this is going to help. I mean, we have posted signs at his office. We have notified former employees that we would like to speak to them. We are notifying patients as we learn of them. And we hope with your help and your partnership, this will get out in the community and people will at least begin to check and see, but not, if it's not him, at least any other physician that they will check on before they go to them. If that's the case and people begin to check and verify that their physicians are licensed, we wouldn't run into this problem. So if community education is a big factor in making sure people don't get taken by physicians like this.
Any other questions?
Can we speak with someone with the health department, with Board of Health?
I don't believe they'll be speaking. I'm going to direct you guys to their PIO up in Tallahassee, so.
Is that it?
All right, thank